Exclusive government documents show that Health Canada's expedited authorization of the novel mRNA COVID-19 vaccines for children came with all risk, and real-world data shows no benefits. In a vindication of what many have been saying for years since the rollout of the novel mRNA COVID-19 injections, initially said to be 100% effective at preventing COVID-19 infection, it's clear through exclusive government documents that Canada's health regulator simply rubber-stamped the rush-to-market product, proving that the regulator does not conduct its own independent safety testing, nor does it use evidence-based decision-making. Since May of 2021, when the government first began discussing authorizing the novel injections for youth, I have been on a quest to determine what data the government used to support and justify this decision. How did they conclude that the unknown risks outweigh the purported benefit? Well, I finally have the documents to share with you. It's been 3 long years, and this work was only made possible through your generosity and support at rebelinvestigates.com. That's a website dedicated to our exclusive access to information requests and government accountability journalism, so please make sure to bookmark it and check back regularly. Now, in an email sent from Senior Regulatory Affairs Officer for Health Canada, Tamara Ugolini, on April 16, 2021, the request for authorization of Pfizer's novel COVID-19 injection for children aged 12 to 15 was officially launched. On page 92 of the document, it's confirmed that the review took less than a month, commencing on April 19, 2021, and completed by May 11th. Under the reviewer's recommendations, it notes that Phase 3 data from the adolescents aged 12 to 15 years of age study with a measly follow-up of at least 2 months after dose 2 showed Pfizer's novel mRNA shot was well tolerated. Not that it was safe or effective, but well tolerated. And that was a strong assertion because on page 88, it becomes clear how few participants were included in this clinical trial. It's acknowledged that this study, titled C4591001, is ongoing and explains that 98.3% of adolescents had at least 1 month of follow-up after dose 2, and a measly 57.9% were followed for at least 2 months after dose 2. That's barely more than half of the participants followed for a mediocre 2 months after their second dose. The number of participants who partook in this clinical trial is embarrassingly small, especially since, according to Pfizer's own documents, the study only enrolled 2,000 participants for the 12 to 15-year age group, with an even exceptionally smaller number, only 1,000 of them, being designated vaccine recipients. If only 58% of them had 2 months of follow-up, that means that Health Canada based their safety and efficacy assertion on an even smaller number, only 580 child test subjects who were followed for 2 months after their second dose. Now, it was clear in March of 2021 when Chief Public Health Officer of Canada, Theresa Tam, knew this was a minuscule sample size, but rubber-stamped and promoted these injections to children anyway, knowing the full spectrum of risks wouldn't be known until the experiment was unleashed onto millions of trusting Canadians and their children.
Every medication or vaccine can come with rare side effects, which will not be picked up until many millions of people receive the vaccine. The initial clinical trial with tens of thousands will not pick up rare events. So I think the important thing, to emphasize to everyone is that we have systems and checks and balances in place. But please do remember that over the course of the administration of the vaccine to many millions of people in the world, if there should be any new signals, we will be communicating that after a thorough examination. But science will continue to evolve in this space.
Nevertheless, Health Canada's Safety and Efficacy Assessment Report breaks down some of the results of that minuscule sample size, beginning on page 73 and on page 74. It's once again confirmed that the novel injection is indicated for active immunization to prevent coronavirus disease caused by SARS-CoV-2. But it was clear by that time that the injections weren't preventing COVID infection. By April of 2021, the new phenomena called breakthrough infections were being reported even by the mainstream media. Aside from the fact that it was well documented the shots did not, in fact, prevent infection, on pages 77 and 78 of Health Canada's own documents under systemic events, it's very clear that reactions across the board increased in frequency after the second dose. Medication use increased in both age groups after dose 2 as compared with after dose 1, it says. Now have a look at this graph on page 78 at the frequency of systemic reactions in those aged 12 to 15. Within the mediocre 7-day follow-up after dose 1, there was fatigue marked as severe, which is described below the chart as prevents daily activity in 15 participants after dose 1, a number that nearly doubles to 26 after dose 2. Severe headache, that prevented daily activity, occurred in 11 children after dose 1, doubled to 22 children after dose 2. Chills so severe that they prevented daily activity in 5 child test subjects after dose 1, a number that quadrupled to 20 after dose 2. Vomiting, so severe it required intravenous hydration in 1 child test subject after dose 1. Muscle pain so severe that it prevented daily activity in 2 child subjects after dose 1. It tripled to 6 after dose 2. Overall, systemic reactions occurred in 77.8% of all child test subjects after dose 1 and 82.4% of them after dose 2. The use of pain medication occurred in 36.6% of child test subjects after dose 1 and 50.8% after dose 2. Scrolling through the next table highlighting those 12 to 15 and 16 to 25-year-olds, it's clear that serious adverse events occurred at double the rate of those compared to the placebo, yet none of them were marked by the investigator as related to the experimental product, apart from one adverse event leading to withdrawal from the experiment in each vaccinated group and one life-threatening incident in 12 to 15-year-olds. One withdrawal had a fever of 40.4 degrees Celsius that occurred 2 days after dose 1 and lasted for 3 days. The life-threatening adverse events are described thereafter. One had an anaphylactoid reaction. They had originally received the placebo, then received the first dose of Pfizer's experimental shot, and had an allergic reaction so severe that they withdrew from the study. Another child also crossed over to receive their first dose after receiving the placebos and became persistently depressed, but that too was considered unrelated. In assessing the adult portion of the experiment, that is those aged 16 to 55, there were a total of 7 deaths reported among phase 2-3 adult participants through the unblinding date, 3 from the original vaccine arm and 4 from the placebo, but none of them were assessed by the investigator as related to the study. Severe adverse events in the adult group were noted as appendicitis, acute myocardial infarction, i.e. heart attack, cellulitis, urinary tract infections, intravertebrate disc protrusion, subactinoid hemorrhage, that's a brain bleed, and deep vein thrombosis or clotting. But none of these were considered by the investigator to be related to the study. As detailed on page 87, 7 child test subjects developed lymphadenopathy or swollen lymph nodes, usually indicating an infection or illness. It's noted on page 90 that the safety data remain limited in the adolescents 12 to 15 years of age and that the safety follow-up period is relatively short. Post-marketing surveillance is required in the adolescent population, see terms and conditions. Health Canada knew all of this before they rubber-stamped this injection and then promoted it to Canadian children through perverse marketing campaigns, which Canadian taxpayers paid approximately $10 million for.
Vaccination against COVID-19 can help kids get back to being kids. Help protect your child and those around them. Book vaccination appointments for eligible children in your family.
Health Canada concludes that based on the totality of the information, the risk-benefit profile of Pfizer's COVID-19 vaccine is considered favorable for active immunization in individuals 12 to 15 years of age. The agency thought the media would have questions regarding the strength of the clinical trial information, or I would say lack thereof, to support the supposed safety and efficacy of these novel injections in adolescents because Canada was the first country to authorize these products for this age group. But in my previous report, the media just parroted Big Pharma's marketing slogans and instead worked to ensure parental consent wasn't needed for children who wanted these experimental injections. The submission sponsor, that's Pfizer, was supposed to provide all safety data for the demographics in this study at their 6 months after dose 2 when it became available, just casually, whenever. And secondly, to provide study reports including safety, efficacy, and immunogenicity data. Now, according to the clinical trial website, the study concluded on February 10th, 2023. Results were submitted a day prior and underwent a quality control review as of March 6, 2024. But you can see here that the quality control review has not concluded because of errors, deficiencies, or inconsistencies. At various points throughout the document, the National Library of Medicine Quality Control Review comment notes things like information within the measure appears inconsistent, and the unit of measure appears invalid, measure types appear inaccurate, or the explanation provided is not sufficient to understand why one or more values are not available. These discrepancies appear throughout the results submission a total of 38 times. Regardless, Health Canada trusted the known fraudster called Pfizer to assess the safety and efficacy of these shots, and then subsequently they rubber stamped it. They say that it's therefore recommended for authorization for active immunization to prevent, there it is again, prevent COVID disease caused by SARS-CoV-2 in adolescents. Now, based on cases reported from at least 7 days after the administration of dose 2, the efficacy of Pfizer was 100%. There it is, effective and based on a 7-day follow-up of roughly 500 participants. Health Canada reviewer at least acknowledges that Pfizer's clinical study was not designed to assess vaccine efficacy on prevention of transmission, but that they expect that an efficacious vaccine would convert severe cases to mild cases and mild cases to asymptomatic. According to the chart, asymptomatic infection rates between both the vaccinated and placebo arms were exactly the same. The reviewers also noted in the supposed to-be observer blind phase 3 clinical trial that the study staff preparing and administering the study interventions weren't unblinded. As discussed with Deanna McLeod of the pharmaceutical reviewing company Kaleidoscope Strategic, Pfizer's adult trial data showed that the vaccine profiteer misrepresented data to hide the fact that the novel injections came with increased risk of illness and death compared to the placebo. Issues included early unblinding of participants, the use of misleading demographics, primarily using healthy young people when the shots were first rolled out on the most vulnerable and sick elderly at a population level. They had no biomarker trackers, something that could have picked up on clotting factors, inflammation, cardiac damage, blood pressure changes, immune system disruptions, etc. The study's own authors had massive conflicts of interest, making up 84% of them being compromised. In an attempt to confirm why these injections remain on the market, still recommended for those aged 6 months and up, I emailed Health Canada to inquire. What benefits do these vaccines provide to Canadians? How does Health Canada continue to justify the authorization of these products? What are the long-term risks? And where is the risk management plan? No one responded to my request, but we know based on a response from the Biologic and Radiopharmaceutical Drugs Directorate Division of Health Canada on June the 1st, 2021, that these shots were authorized for children because, and I quote, the Pfizer-BioNTech vaccine will play an important role in protecting younger Canadians, their families, and their communities from COVID-19 illness, hospitalization, and death. But none of that was part of the trial outcomes, and so none of it was studied and cannot be ascertained. Nevertheless, they repeated this unfounded talking point, and I quote, the availability of safe and effective vaccines will reduce the spread and severity of COVID-19 disease and reduce its social and economic consequences. On June 9th, a correspondence, again from the same, further described vaccine acceptability of parents and guardians as reasons for authorizing the injections. The BRDD dedicated an entire paragraph trying to prove that children were asymptomatic super spreaders of COVID, once again reiterating the availability of safe and effective vaccines will reduce the spread and severity of COVID-19 and reduce its social and economic consequences. They even used one of conflict of interest riddled Fissman's preprint papers pretend modeling scenarios as evidence to allude to schools being safer once these products were authorized. In that email, they state that Health Canada's review of COVID-19 vaccines and therapeutic products is based on a qualitative risk-benefit calculation at the population and public health level. This proves my June 16, 2021 report where I conclude that feelings, not facts, were driving Health Canada's decision to vaccinate and push these injections on children. It has aged exceptionally well. For Rebel News, I'm Tamara Ugolini. If you'd like to see these shots pulled from the market, then please head over to our campaign at nomoreshots.ca. There you can send a form email to Federal Minister of Health Mark Holland calling on him to revoke market authorization for these injections. And you can also consider chipping in to support our work on this file if you're able to. All of that and to learn more, head on over to nomoreshots.ca.